amazing. So what is, I feel like I'm asking a lot of questions, but it's mostly because I want people
here
to get to know what you do. And I think what you do is so amazing. I have several friends that have struggled with infertility. One of my very close friends got pregnant last year after 4 years of trying, and just a beautiful outcome. I mean, it's incredible when they get to that place where it's just everything clicks, and a huge part of that was cleaning up her environment and getting rid of toxins was a huge part of that. So but what I wanted to ask you was, when you're kind of going through your assessment with a client, what are you looking for with them? Like, what are the things that you look for to really tell you where to focus and what steps might need to be taken first?
So before of course, I don't just work with anybody. I'm sure you're like that. We have very busy schedules, and there are a lot of people that need our help, and so it's impossible for us to help everyone.
Right.
Number one, I want to make sure that the spouse is supportive.
Yeah.
It's good to have my support and the spouse's support together. I mean, that mixture combined is major.
Yeah.
Second, I want to know like how bad they want this. Some people, it's just kind of like, well, no, it's okay if I adopt. And so if you're okay with, like, if you're already thinking like, no, it's okay, if it doesn't happen for me, it doesn't happen, then that lets me know that maybe I can help someone else, because there are other people that desperately want to get pregnant. So I kind of save my energy for those people that are like, they really, really want to get pregnant. Adoption is an option. And so I think those things are the key. And then of course I need to like mesh with the person. I'm all about like positive vibes. That's why when I met you, I was like, Andrea, she's my girl.
Yeah.
I have to because if we're going to be working together, I love what I do. I love my job. And so I want to like enjoy every conversation that I have. I don't do things that I don't like. Otherwise I'll go stuff myself in the laboratory somewhere, or, so I just make sure that whoever I'm working with, I get them on the phone, I hear them talk, I have a conversation with them. And then, hey, if we are connected, if we're cool, if we seem like we can get along, then that's important to me, because I'm not gonna, if I have a doctor that I don't like, or the doctor doesn't like me, then it's not beneficial for either one. So I believe personality is a big part of it. It doesn't mean that they have to be like this bubbly person, but you know what I mean? Like whenever you like, certain people are like, oh yeah, I could work with this person. Because if I'm talking to you every week, then, there has to be some kind of connection there.
Especially because it's an emotional process.
Right.
It's not just an exchange of I'm writing you a prescription and off you go. Like there's an emotional exchange that happens when you're working with women with hormones, fertility, whatever, like in the spectrum. So you do have to have that, yes, I can work with you. Doesn't mean they have to be, like you said, happy, perfect, whatever. Like that's not the criteria, but the criteria is that there's things we agree upon, and we have, we jive, like, it works, and it's not, it's going to be resisting you the whole time, or resisting the process or whatever. So anyways, continue on. I just wanted to tack onto that a little bit.
Yeah, no, I agree. There has to be some level of trust as well. I have to trust the person I'm working with, that they're going to be honest along the journey. I have one client, actually, I just finished with her today. I'm so excited. So she was having some issues. She hadn't had a period since last year. And so I worked with her, and so she's had 2. And so we're very confident. I got her to ovulate. So I'm just so happy. So with her, she was completely honest, and she was like, I can't do this component of the program that you're asking me to do. For some reason, I'm struggling to do it. And so we're able to have that honest conversation, and I was able to help her and assist her through that. So I need to know that, you're honest with me, that if you're struggling, it's okay. This is hard stuff that you're, going to go through. So I trust that you're going to do your best. Then you're trusting me that I'm going to do my best to support you along your journey.
Exactly. And would you say that with your the women that you work with, the women that you attract to work with you, would you say that there's a fair amount of medical mistrust by the time they get? Because I have that a lot, and it's something that trust is so valuable to me that I'm like, I will show you that I am trustworthy because of my own experience. So I'm just curious if you've experienced that, and kind of how you identify it in somebody that you're talking to, whether it's, you know, a breakthrough call or a potential, you know, somebody that's a potential client. I'm just kind of curious, you know, how that works for you.
Yeah. So, I think the biggest issue that I'm finding with women is they'll come to me and say, I have, you know, endometriosis, I have PCOS, but they don't even really know or understand what they've been diagnosed with.
Yes.
And so I just find that to be like mind blowing that nobody even explained it to them. You know, I almost cried one time when I think this was it was sometime last year. I was talking to a lady and I asked to see the results from her scans. She just said, I've been trying to get pregnant for a year. I don't know what's going on. It was over a year, and I went and I got scans, and I still don't know what's happening. So I looked, and then I looked on there, and she had cysts, she had fibroids. And then I told her, and I said, okay, so when did you find out you had fibroids? She had no idea. No idea that she had fibroids. And so that's what she was crying on there. And she was like, nobody ever told me. Like, they just keep telling me that my blood work is fine. And now I'm in this crisis, you know? So I think, number one, women don't understand what's going on. And then I tell women, like, you have to understand, okay, if your doctor isn't helping you understand, come to me, and then I'll explain things. I'll break things down for you. And so absolutely. And sometimes women don't even know their Inez. Hi, Inez. Thanks for joining. I see Rosalind. I see a lot of my people on here. Yeah. So no, that's definitely number one. Number two, it's that they feel like their primary care physician doesn't have time for them. It's just kind of like, hey, a 2-minute conversation and they're out.
Right.
So that's a big thing where it's like, how can I trust you to do a myomectomy on me when you're only in here for 2 minutes, and then now you want to take me for surgery to remove my fibroids? You know, those are some of the issues that we're facing. But yeah, absolutely. Most of the people that come to me have no trust for their physicians. They're looking for somebody to trust.
Exactly. And I think, you know, there are many calls that I've gotten very tearful with the client before because of that. Yeah. Disregard and the brushing off that happens, or and I think honestly, a lot of it comes down to there's still so much normalizing of abnormal symptoms.
Right.
Like it's not normal. It's common. It is common. That doesn't mean it's normal. It is common to have periods. It is not normal, nor is it an indicator of a healthy cycle to have painful periods. It is not normal to not ovulate. Right? So I think some of it is even just that education piece of helping women to understand their bodies and get really comfortable understanding what their body does and how it works a certain way, or what can help it work a little bit better, or, you know, optimizing their cycles, things like that, so that, you know, or even just for the purpose of that when they go to their doctor, they're more empowered, right?
Yeah.
As they're working with us, so that they can ask better questions. Or, you keep telling me my labs are normal. Are you even doing the right labs?
Right.
Like, that's because I get that all the time. We're like, oh, let me send you my labs, and all they have is a TSH and a BUN and a liver function panel. I'm like,
creatinine, that's it. Yeah.
That doesn't help me at all. Like, like I need so much more than that. So yeah, and I think, but it's a privilege when you get into that place with a client and you, that moment of trust happens. You know what I mean? Where, okay, established a trusting relationship here, so that when we hit those vulnerable spots in the process, because it's going to happen, whether we're talking about, you know, for me, libido, or whatever, for you, all the things, they're at a place where they can be open and honest about the things that are really impacting that part of their healing.
Yeah. So important to have that. Otherwise, what are we doing? You know, why waste time on calls? Why waste time changing your lifestyle if you don't trust in the process? Exactly. Not just me, but the process.
Right. And having the permission to ask questions when you're confused.
Right.
And this is just how we do it.
Yeah. Right.
A lot of it happens. We're like, okay, let's break this down in a way that you can understand it, so that it makes sense for you. Because it doesn't matter that it makes sense to me. It has to make sense to you, because you're the one following this process. And when we understand why we need to do something, or why we need to track our cycle, or even if it's just for 3 months, you know, like why we need to do those things. If we don't understand that, it's a lot harder to engage in the. So what are some things, you know, you would, you know, if you could broadcast it out there, this is what I do, this is who I help. What are some things you want women to know that are kind of like red flags that you should be, you know, diving into help for your hormones, or getting, you know, basically optimizing your life for fertility? Like, what are some of those red flags that they should be reaching out for help at that point?
Number one, inconsistent, irregular periods.
Yes.
If you have an irregular period, please do not attempt to try to get pregnant with an irregular period. It just sets you up for a disaster. So number one, irregular periods. Number two, if your periods are painful, if you're having all these, you know, crazy symptoms, you can't go to work, you're in pain. You know, I have my period and it's completely painless now. You know, so there are ways to completely balance your hormones. And I know you know all about that. That's your your expertise. You know.
But it's true. You can actually have painless periods, and I didn't believe that until I didn't have any pain. I was like, I didn't even feel my period coming. Showed up one day, like, oh, yeah, it's real. Continue. So painful period.
From not liking period to now like loving it.
Yeah. Right.
Okay. So another thing that I was like on my Facebook group about yesterday was like, stop all of this insane, like having intercourse a million times to try to conceive. If you are like constantly every month, like peeing on ovulation sticks every single month, and you're always trying and just like having intercourse multiple times a day, if you're like going through months of that, then just stop. You know, it just takes one time to have a baby. Just identify your fertile window, and then I teach women it's very clear for you to know when you're fertile. Once you understand your body, you know when you're fertile. It just takes one time to have intercourse, and that's it. So my next red flag is if you've been like going through and just killing and breaking your back to get pregnant, that's a red flag for me that maybe it's time to look a little deeper into things. Right.
Yeah. And do you, with your practice, do you do lab testing, or do you recommend that they have lab testing initially?
I do lab testing.
Or recent, like within the last 3 months kind of something.
Yep. Okay. So I usually get my own lab testing. Some women come to me with the lab tests. And then for some women, we don't need lab testing. It just depends on the woman's goals.
Right. Totally. Yeah. And I think this is, just to kind of touch on this a little bit, lab testing is valuable when the lab test itself is accurate, meaning like that it's enough of the picture that it's valuable information for whoever's reading it. So for example, I get a lot of women who are like, I had my cortisol tested and it was fine. And I'm like, okay, but was it serum? Because if it was cortisol one time, that tells me nothing about your cortisol. And they're like, wait, what? So some of it is, you know, to me, it's almost no value to have lab testing, because some of it's not going to tell me anything. Your symptoms are going to tell me a lot more about what's going on in your body.
Right.
But when they're done right, it can be very helpful.